Hello and welcome to Pace Hospital's podcast, where we discuss important health topics that help patients make informed healthcare decisions, that is, breast conserving surgery, also known as lumpectomy. A surgical treatment option for breast cancer where the cancerous lump is removed while preserving most of the breast. Joining us today is Dr. Ramesh Parimi, consultant surgical oncologist, who has wide expertise in the diagnosis, treatment, and surgical management of breast cancer. In today's episode, we'll discuss the importance of understanding breast conserving surgery, that is, lumpectomy, including who has need this procedure, how it is performed, its benefits, recovery, and when radiation therapy may be advised after surgery. Dr. Ramesh Parimi, thank you for joining us at Pace Hospital's High Tech City. Let's start by understanding breast conserving surgery procedure.
Hi friends, as some of you might be aware, I am Dr. Ramesh Parimi, a surgical oncologist, and I am with the Pace Hospital's Madhapur High Tech City, Hyderabad. There has been a request for some procedure for breast cancer called BCS, Breast Conservation Surgery. People have been asking whether breast can be saved during surgery in a case of breast cancer. The answer is very much yes. So the topic of interest today and some kind of knowledge to give you all is BCS. As you know, breast cancer has taken the number one place among the incidence of cancers in women during the last 10 years, though rural folks used to be afflicted much less compared to urban folks. Now the statistics show that women in rural areas are also equally commonly affected, and this cancer develops in both urban and rural women with equal incidence. Now, whenever there is a tumor or breast cancer, in the breast, the usual dictum is to remove the breast. The organ of origin of the tumor is removed. That's the usual surgical principle in cancer treatments surgically. But with a lot of literature, experience and trials coming up during the past 50 years, during the last 35 to 40 years, the concept of BCS, breast conservation surgery, has come into vogue. It's now totally established, well beyond doubt, that breast conservation is possible as a part of treatment of breast cancer surgically. Of course, there is a specified number of cases.
Dr. Ramesh Parimi, what is the purpose of breast conserving surgery?
The main purpose of this operation is not only to save the breast, but also to treat completely without any compromise about the surgical principles of cancer treatment. The main principle in cancer treatment is that we have to do an RO resection, that means R0 surgery, where the tumor cells are not even found microscopically in the removed specimen or in the leftover breast. That is the idea of scientific and also cosmetically doing this surgery. So the breast surgery here includes what is called removal of the part of the tumor along with a good amount of the normal breast tissue. The idea is that as much possible as it warrants, normal tissue has to be removed so that the cut margins or the microscopic edges of the tumor removed or the lump removed, the total specimen, let me say, removed, is free of cancer cells. Not only the tumor along with the liberal margins and also along with the normal tissue is removed, the nodes also in the axial armpit are also addressed to in the same sitting, because the breast cancer can spread to lymph nodes in the armpit, as you know, on the same side. That's called axillary lymph nodes. As you might be aware from previous talks from various doctors, the lymph nodes in the axilla are spread in three stages. It's three levels: level 1, level 2, level 3. And these nodes are diagnosed whether they are afflicted with cancer or not. The cancer cells are migrated there or not by various means before surgery itself, like PET scan, ultrasound scan, and also nowadays we have got sentinel node biopsy technique, wherein only particular affected node or nodes are removed instead of disturbing the whole of the axillary anatomy and also the lymph nodes. So the overview of this operation is BCS is that the tumor along with normal breast tissue is removed adequately. Of course, the tumor size should be not more than 3 to 4 centimeters. So we call T1, T2, T3, T4 stages. So stage T1 and T2, tumor size being 1 to 2 centimeters or the most 3 to 4 centimeters is ideal. Beyond that tumor size, the operation BCS may not be suitable because the experience shows that the bigger the tumor occupying more than one quadrant, the more likelihood of again recurrence in the remaining part of the breast when BCS is performed. So even in the tumors about 1 to 2 centimeters, no debate at all. It can be straight away removed along with the whatever surgery to be done on the axilla. But those tumors which are around 3 to 4 centimeters, one can give a neoadjuvant therapy. That means before surgery, some kind of treatment would be given, mostly chemotherapy, followed by surgery, and later on again chemotherapy and radiotherapy as the indication may be. So the purpose of this operation is to conserve the breast and also to treat adequately without any compromising on surgical principles the breast cancer surgically. And in doing so, it should be remembered that BCS most of the times, if not all the time, most of the time needs extra treatment which is called adjuvant therapy. The adjuvant therapies following surgery is in the form of radiotherapy with a boost to the tumor bed or the place where it's according to the breast where the tumor was situated with a boost to it. That is called external beam radiotherapy. Previously, brachytherapy was done enthusiastically, but nowadays with modern gadgets of radiotherapy, brachytherapy is not always needed, but external beam radiotherapy using IMRT technique or the machines is adequate. And in deserving cases, depending on the further investigation called ISC, the chemotherapy also may be given for these patients.
So, doctor, what are the complications of breast conserving surgery?
Complications of this operation are not many, and maybe some kind of collection is there. That's why a drain is always placed in the breast under the incision where the cavity is left behind after the removal of the tumor with the breast tissue. And also, if necessary, one is left in the axilla if the nodes are addressed to surgically. So the only complication noted is what you call immediately after surgery collection, that is called seroma. The late complication are not many, but only related complication is recurrence of the tumor in the same breast having been treated by BCS over a period of time. That happens about 2% of cases. Even those adequately treated and suitably selected for this purpose do develop recurrence, that is called local recurrence in the breast, remaining part of the breast. That is long-term complication.
Could you explain what are the advantages of breast conserving surgery?
The advantages, as you have already been aware, the cosmetic and the surgical principles being applied. The main thing is that the victim of this disease, lady, will have the psychological satisfaction which usually boosts her morale that her breast is preserved, and it would do lots of good for her psyche also, and she'll be very happy that the organ conservation has taken place in spite of the dreaded disease she had been afflicted with.
Dr. Ramesh Parimi, what is the recovery time after breast conserving surgery?
The recovery time following BCS is generally about 3 to 5 days. Most of the ladies go home next day itself unless there has been a drain placed, and one can also be discharged with a drain in situ with some precautions being given how to safeguard the drain and all that. So it's now nowadays has become a kind of a daycare procedure, BCS. That means morning the lady is ushered into operation room. By evening or next day morning at the most, she checks out of the hospital. So it is a very good operation by all means, and also with the various techniques available as kind of additional treatment or adjuvant therapy in the form of radiotherapy and chemotherapy, and also the investigations which predict the long-term prognosis. BCS has become part of the treatment of breast cancer surgically all over the globe, including India and Hyderabad. One of the commonest operations performed. So one need not be very much scared that she is bound to lose the breast 100% when a cancer develops in the breast. The alternative procedure like BCS is also equally good and equally dependable. And this is all for today, friends. Any issues, any doubts, you can always interact with me on the page what you are going through.
Thank you, Dr. Ramesh Parimi, for sharing crucial information about breast conserving surgery with our listeners. Hope this information is helpful to our listeners. If you have any further questions regarding breast cancer treatment or breast conserving surgery, please don't hesitate to consult an oncologist or surgical oncologist. Remember, breast cancer treatment is a journey that requires awareness, timely diagnosis, proper treatment planning, and emotional support. With the right medical guidance, advanced treatment options, and continuous care, patients can move forward with confidence, strength, and hope. We'll see you soon on Pace Hospital's podcast with another informative episode. Until next time, take care and stay healthy. Thank you.